Hi, I'm Julia here with Taline and Mahir. Today we're at UConn Hartford with the Department of Public Health Sciences asking students what they know about health. Hi, I'm Julia. I'm with the Department of Health Sciences at UConn. Can I ask you a few questions about health?
Sure.
Okay, perfect. So my first question for you is, how do you think income affects somebody's ability to live a healthy lifestyle?
I think when it comes to money, like income, it play a crucial factor, not just people who's in it in healthcare, but for everyone. And if you don't have money, you cannot pay for the bills, pay for the medicines, or medical facilities, stuff like that. So I think income plays a crucial a role in life.
Yeah, definitely. I think you really hit the nail on the head there. With somebody who does have a higher income, they have more access or are able to afford things, like you mentioned, medications or hospital visits or even specialty care that maybe some people who don't have the same access would be able to, or the same income level. And then going off of that, people who live in more rural areas, like maybe not so much in Connecticut, we're not super rural, but places like the Midwest where some people maybe are 2 or 3 hours away from a hospital, that could really affect their level of care as well.
How do you think income impacts someone's ability to live a healthy life?
It's greatly impacts from everything from where you work, where you live. Those go ahead and dictate what services become available to you, what sort of community resources. It's a great disparity across our country at the moment, and it impacts for people who are middle class, they have access and can go ahead and get these resources, but when your housing situation determines your school district and your school income goes ahead and dictates what funds become available to your school, it just sets you further and further back behind from the moment you step foot into the world.
Yeah, and specifically here in Hartford, if you know about the community, how do you think it affects people's health here?
I just moved up here this summer, so I'm still learning my way around the neighborhood. I can tell that just like in the easiest example I can come up with is public transit. Coming from New York City compared to Hartford, the availability of public transit goes ahead and impacts how much time you're spending at home with your family, which is a predictor of childhood success at schools, because more active and more engaged parents is going to go ahead and do that. And so when public transportation is slow or inconsistent, it's going to go ahead and impact that. It's how much time you're spending now going to and from work, which is why so many people are proponents of work from home. And so that's just a small little drop in the pan, as it were. But better public transportation, better accessibility to all the services, it adds up over the course of the day. And so there's a lot of work that still can be done.
How do you think income affects people's health?
From my own experience, coming from a less fortunate place, I know that people in my community down here, they have less access because they have obviously less money and less knowledge and stuff. So I feel like it's more of a class thing. Like if you're in a middle class to higher class, you'll know more about it mostly.
Thank you for participating. That's all for now. Follow us on our social media to stay updated on if we're going to have an event coming up in your area, and participate in our interview questions to win prizes.